Introducing Longevità Medical, embodying the future of medicine, focusing on proactive treatments to improve the quality of patients' lives. Longevità Medical offers compassionate care at the practice in Victor, New York. Patients range from those who live with the effects of age-related hormone imbalance or joint pain to competitive athletes seeking advanced treatments for sports injuries. Longevità Medical is under the medical direction of Dr. Vito Quatella. Dr. Quatella, would you consider yourself an entrepreneur, as well as a physician, as well as a surgeon? Would you consider yourself an entrepreneur?
Yeah, I've often thought of myself that way as an entrepreneur, basically a physician that expresses his entrepreneurship through medicine.
When you look at the Quatella Center for Plastic Surgery, Q Med Spa, when you started your practice, did you have a long-term goal, even if it's been refined over the many years, about how you wanted to build a practice that would work with patients and treat them holistically?
Basically, I've had this concept at the Lindsay House of treating everyone from head to toe. Literally from the hair on the top of their head to
skin on the bottom of their feet.
Right, exactly. And so that's sort of come to fruition because, we have tremendous plastic surgeons that do body work. We have our facial plastic surgeons who do the facial work. And then we have a group of nurse practitioners and physicians that also treat the non-invasive stuff. So we've covered all the bases in aesthetics. This new endeavor with Longevità really starts to look at, is there something preventive that we can do?
It's the idea of potentially proactive treatments. It's not having to be, okay, I have something, now I come to you for a solution. It's about a partnership with patients. I think you might agree that you're going to work together to help achieve an outcome, and you're making a plan, kind of the way a financial planner might work with you to say, how do you want to live your life in retirement financially? Now you're going to work with a doctor and a team of physicians to say, how do you want to feel, look, experience your body as you continue to age?
That's exactly correct. And I think my biggest influence on this decision was from my own patients. This isn't something I just thought up yesterday. This has been coming for 20 years. But yesterday I saw a 94-year-old patient who I always ask, what do you do? Her joints are in great shape. She has 9-foot doors in her home and she stretches from them every day. She gets on a stool and stretches and has a routine that she works out every day.
That's what I want to be when I grow up. Yeah, I want to be the 94-year-old that still has not only the physical ability to do so, but also the desire to know that the things you do every day can make a profound impact on your quality of life on a day-to-day basis. You don't have to dread aging. You can just experience it and thrive through it. So you get this idea for Longevità Medical. I knew that you were working on this or thinking about this a few years ago. You get this plan in place. You're out in Victor on Route 96. What did you want to do there? What was the nugget to say, okay, if we're going to do something that's brand new, that is a separate entity from Lindsay House, as people know us here on East Avenue, what do we want to do here?
The buzzword for the next decade is going to be regenerative medicine. And that's kind of a broad term that encompasses a lot of things. But there's many, many things on the horizon. The first place we're looking is within ourselves because they're restorative cells that we have both in our blood, in our bone marrow, in our fat that has the capacity to regenerate other types of cells in our body, like regenerate our liver or regenerate cartilage. And so we're just scratching the surface with what this is able to do. There's been tremendous strides in orthopedic medicine. And actually, the first time that I encountered PRP, which is using growth factors in your blood, was about 10 years ago with horses. And my daughter rides horses, and they took PRP to regenerate some cartilage in a joint. And that preceded even the orthopedic use of it.
And so these are technologies that are coming into play, which many of us outside of the community might look at to say, this is science fiction, becoming science fact, becoming practical application. We always hear our bodies are incredible regenerators. We have the ability to heal. You cut yourself, you put a Band-Aid on it, a few days later it does start to heal. So we can actually see it, but we can take it further than that?
Yeah, absolutely. I mean, the type of stuff that's occurring right now in the country in research is truly science fiction. things like creating ghost hearts, where they actually dissolve all the muscle in the heart, leave the vasculature intact, and then add stem cells
to build around it.
Yeah, stem cell progenitors to build the muscle back and actually get beating hearts, which they've transplanted into dogs and pigs. I mean, this is, the future is coming faster than you think, and so there's many technologies. But there's some things that are immediate and that are available now. And so one of the things, again, when I look at my patients, I'll say, what is it that you're doing, or what, and one of the things that came up is women who were in menopause and men in andropause who sought out bioidentical hormone replacement actually looked younger, looked more fit. They looked thinner. There was a lot of benefits to that. And so I started exploring that a little bit more and realized that if you replace hormones after menopause, and I say andropause, which is a reduction in testosterone in men, what you find is that the benefits aren't just the more apparent things when people think about libido and sexual function, but the reality is that you lose visceral fat. That's that fat around your heart, fat around your liver. You actually do better with bone density, more important in women. There's so many factors that get improved that this is one of the things that makes sense. And we're not talking about longevity. There isn't anything right now other than in animal studies that's been able to reverse age or decrease age. But we're talking about living younger. We're talking about living, like if we're going to live to 90, let's say, we want to live like to the fullest and then go down as opposed to decline from 50 all the way
Let's
down.
have the right quality of life and balance the quality of life with the medical advancements that are there to find the treatment path. When you talk about proactive treatment paths, it would seem that based on what you're telling me, and we're just scratching the surface here about what you're doing with the new venture, is that it's finding the way to, again, not say I'm going to live longer, but I'm going to be healthier for as many years as I possibly can. And then really that's the ultimate goal here.
Correct.
And it surprises me that this technology is available, that these are available. I'm surprised that every doctor is not doing it.
Yeah, that's an interesting question. So there's conformational bias. And the mainstream medicine, when we talk in the realm of bioidentical hormones for a second, and we're going to get to sort of what Maria does, but that there was a study turn of the century, 2000, 2001, that said that hormones replacement causes breast cancer. And it was a faulted study, and everyone admits now that it was faulted for many reasons. It was a synthetic hormone that was used. There's many reasons why it was. But, now looking at outcomes data, there is no outcomes data that shows that bioidentical hormones, progesterone, estrogen, that are bioidentical, plant-based, that they cause breast cancer. There is absolutely no outcomes data that shows that.
The downside is that study got out there.
Oh, yeah.
And it made a lot of waves very fast. And it scared potentially a lot of people from seeking these types of proactive treatments.
Correct. The media took it. Took it and ran with it.
And then now you're doing two things. You're trying to work with your patients, but you're also trying to dispel faulty information. And I would say dispelling faulty information is far harder than developing a patient relationship.
Yeah, that's absolutely true. But the plus is that there's many people who are miserable out there and unhappy. And that when they avail themselves to this, it's life-changing. So granted, there is that conformational bias, and we're not trying to convince anybody. They're made totally aware of all that.
You mentioned Maria, so we're going to bring her into the conversation. Dr. Maria Karapides-Puria is a board-certified physician. How did you come into this guy's orbit?
Yeah, I guess it's a little bit of a long story. So I practiced orthopedic sports medicine for 7 years, and I always wanted to do a little bit more with regenerative medicine. So I did practice and performed PRP and bone marrow concentrate injections. And just through conversation and mutual connections, we came together, and I was really fascinated by some of the things coming down the pipeline. And just in meeting with Dr. Quatala, I knew that we had the same vision in how we treat patients.
Working in sports medicine, though, I would imagine you would maybe be an early adopter of non-surgical techniques, because I have seen far too many, especially with athletes on many levels, high school to college to professional, who have wound up having their careers or their passion for a sport cut short because a knife was used. But that was at a time kind of the only thing. It's like, oh, well, season-ending surgery. That's it, and they have to go in that route. When did your vision on what you will be able to offer with your patients really start to expand?
Coming from a primary care sports medicine background, I practice non-operative orthopedics. So I saw a lot of these athletes that were frustrated and wanted to get better quicker and get back on the field or on the court. And there's a place for surgery for some of these patients, but also we've learned that over time, just because there's a meniscal tear, we don't need to operate on that arthroscopically. It can actually cause premature breakdown of the joint. So with some of these regenerative techniques, we're able to slow that process down. And even with physical therapy and adjunct treatments that we can offer in the office, that can sometimes inhibit or prohibit the need for surgery in the right context.
And we're not just talking about what athletes could potentially benefit. You work with older adults as well. Many get to that point where surgery does become an only option. Knee replacement, hip replacement. But I've seen it happen in much younger people who have been put into protocols. My wife is an example, had a knee replacement in her late 40s because of a meniscus tear, operated on arthroscopically 20 years prior. So she wound up in that particular position. As we continue to age, though, how proactive can and should we be to seek out options that are going to protect our joints longer so that we don't end up having to prematurely go in for a surgical option?
Yeah, absolutely. So I see the full spectrum of patients. So it's anywhere from high school or high-level athletes, college athletes, all the way up to the geriatric population. So I try to tell these patients that if something doesn't feel right, or if you have pain and you feel that you have to push through that, that's the best time to actually come in and get evaluated. But also that doesn't mean that patients can't be proactive and come in and get a consultation where we can evaluate the biomechanics and take a look at their joints as a whole, the joint above and below, and really just start to focus in on what are their needs, what are their goals for the future and their long-term plans. And that could be as simple as walking with their grandchildren or going on a trip or really competing at a high level. Those are the ones that we really can see in the office and get a nice comprehensive evaluation and come up with a plan together.
Or you can stretch on the top of a 9-foot door frame.
Yes.
Like every 94-year-old should be doing. You're at Longevità Medical in Victor. You've been seeing patients there since December, right?
Correct.
Talk to me about how you've seen this early part of the practice and what is exciting you about what this new endeavor that Dr. Quatela has started.
I think being in a private practice, you have that time to actually dedicate to listening to the patient, and that patient experience changes quite a bit. So you're able to listen to them, provide a thorough, comprehensive evaluation, talk about what their plans are, their long-term goals, and then really offer them the spectrum. Some patients don't need to go all the way to a stem cell procedure or a bone marrow concentrate procedure. Others just need a little bit of counseling, a little bit of guidance and physical therapy. So it's not a one-size-fits-all, and it's exciting to see that I can offer this spectrum to the patients from a non-operative measure.
And it's also nice to know that from a patient perspective, they have options available to them that are far greater reaching than, say, their general doctor or an orthopedic surgeon might be able to offer them. Dr. Quatela, how do you want to work with the medical community as a whole right now to let people know that there are additional options for second and potentially even third opinions on what could potentially help someone with an ongoing condition that they want to live with but thrive with?
Surgery is not for everyone. Sometimes people aren't in the best state of health to have surgery, and sometimes trying alternatives and non-invasive alternatives can help a lot of people. We've had anecdotal personal experience in my family with my wife's shoulder. She's had PRP injections and she's had fat grafting into the joint, and it's kept her out of the operating room. So Maria's got many, many stories like this, but I'm just saying that as you're thinking about a surgical alternative, think about the non-surgical alternative, right? And there are situations where you have bone on bone, where there's surgery is definitely indicated for many, many situations, but we just have to be thinking that there's other alternatives.
And there are other alternatives that have staying power to them. We think surgery, okay, if I want to fix something permanently, surgery is my only option. It has to be repaired. Convince me otherwise. What's the long-term prognosis, as you've seen with the patients that you have worked with, about doing non-surgical procedures and how lengthy the relief and active life can go from those?
I have patients that have maybe like a partial rotator cuff tear. Those are the ones that typically we try to treat conservatively. So we'll start with physical therapy, see how they progress, see them back in the office closely. And if they're still having pain, I have done PRP injections where the patients have gone a year, 2 years or more, and they're able to still complete their activities relatively pain-free with non-invasive measures. There's other patients where maybe they have grade 3 on the KL scale of close to bone-on-bone arthritis, but they're more in the moderate range, and we've tried conservative measures, and they've been able to lose weight. I had a patient who was about 50 pounds overweight, and we talked week by week about how we can try to improve his nutrition. And he did it. He lost his weight. He was able to exercise. And how we did it, we did PRP. We did a little bit of gel injections or the visco supplementation injections. And that combination is what worked for him.
There's two things about that I like. Number one, the older I get, the less medicine I want to be on. I mean, that's my personal opinion. And I know I can't avoid it forever. And it does help. And I know it's there for a reason. But that's just my mental thing. Number two, when you talk about nutrition, just as an example, we don't know what we're doing most of the time. When it comes to food and how to properly fuel our bodies, most people are completely clueless. And in that whole proactive approach, adding that part of it in, how valuable really is that? Or can it be?
It's definitely a part of the equation. I mean, you have to look at everything as a whole. It's not just you're exercising, it's also nutrition-wise. So do you live a healthy lifestyle? How is that incorporated into your day-to-day routine and activity, in addition to what we're doing interventionally in the office? So movement is medicine. I tell all my patients that from the beginning. The more that you move, the better you're going to feel. And then I'm just there as the GPS. Okay. So you're the driver on this, but we work together, and nutrition is a very large portion of it.
I'll consider you the guiding star. How about that?
Thank
the
you.
North Star.
Yes.
Dr. Quatela, going back to how nutrition plays in, and we often think that how our bodies process food can have an impact on our hormone balance in many cases. How then are you trying to balance with hormone replacement, with using the bioidentical hormone treatments? How then do you have to balance nutrition with your patient as part of an ongoing plan to make sure that they're getting the most benefit out of what you're doing with them and instructing them for?
I think the problem isn't solved by one thing.
Right.
It's not solved by PRP or by, bioidentical hormones. But what part of our plan is to take a totally holistic approach to this. One regenerative thing your body can do that you can do very simply is intermittent fasting. And I'm a huge proponent of that. And we will incorporate these diet protocols also into what we're doing. But intermittent fasting is your own body's way to repair itself. It can take cell polypeptide from another part of your body and then just create a new cell. And everybody thinks it's about weight loss, but it's there's so many other things going on when you do that.
That's the headline grabber, of course.
Right.
And that's something that people are very much interested in.
Right.
But with Longevità Medical and what you're hoping to do long term is to get people to have a different conversation with themselves, maybe about overall health, about how you build overall health, because you're really just not going for the brass ring.
Right.
You've got to take some steps to get there, and the team assembled is going to really just try to walk people through those steps, get them to be comfortable taking those steps.
Yeah. So the point here is that there's two disparate worlds between what Maria does and what I do, but they're actually the same world. And so, for example, PRP, we're using that for hair restoration. She's using it for joint restoration. We're using it for skin restoration. Fat grafting, I've used it for restoration in the scalp. When we do fat for volumization of the face, when we take it from your belly, for example, put in your face, not only do you volumize what's missing, what's deficient, because as we age, we lose facial volume, but your skin looks better. Like instantly, someone who's a smoker, their grayish skin pinks up. And so there's something going on there that we've known for years, and now we've been able to sort of quantify it. And we understand that there's growth factors, that there's things that stem cells do. They secrete things called exosomes, and people now are taking just exosomes and injecting that. And so there's a whole future around this regenerative medicine that's going to sort of bring the preventative aspect and actually be able, I think, to turn back a little bit the hands of time. Kind of like what we try to do with lasers and with surgery, all more invasive.
There's a way, and I want to get your opinion on this as well. Yeah. The body is amazing, and it has an amazing ability to do wonders for ourselves. And would you agree that most of it is untapped? That we have more potential if we have the right guidance?
I definitely agree with that. So even just with our platelets, if you cut your finger, there's a phase where it goes through inflammation. Then it goes into this proliferative phase where new tissue is being laid down. And studies have shown that sometimes that gets disrupted, and that leads to what we call tendinopathy, or kind of wear and tear of the tendon. So when PRP, we can use our body's own platelets, where we can spin that down, that blood that we're extracting, and isolate those platelets in itself, those growth factors, start signaling and start creating that new tissue. And that is something that I think has a lot of potential with joints, with ligaments. Same thing with mesenchymal stem cells from the bone marrow. There's so much potential for that to regenerate into what it's known to do: bone, muscle, ligaments, tendons, and cartilage. So I think there's a lot more studies on the horizon that will present with the bone marrow, but we have studies for over the last even 40 years on PRP.
And it's yours, it's your body. I would suspect then less chance of rejection, less chance of serious side effect, because it's you helping you under the right guidance.
That's correct. And it's done the same day. It's done in a sterile technique right in the office. Patients go home. They really don't have much downtime. If you compare that with surgery, it's a few days to maybe a week. And if you look at long-term benefits from that, you're looking at anywhere from 6 months to several years.
Dr. Quatela, you've created this brand new enterprise, Longevità Medical. You're treating people from the hair on their head to the skin on the bottom of their feet, men, women of all ages. When you look in the rearview mirror now as to what you wanted to accomplish in this community, how you wanted to treat patients holistically, how you wanted to give them the most proactive options available to you, you're never going to be at your finish line, I don't think. Mm-hmm. But have you taken a step closer to what the dream may have been?
I think I have, but the thing that prevents me from saying, yeah, we've accomplished a lot, and I have that issue. I don't look back and say, oh, wow. Yeah. But we're really at we're just at an amazing point, because a lot of this stuff was talked about like sci-fi, like you said, but now a lot of this stuff is going to be a reality in our lifetime, and that's very exciting. I mean, to me, that's very exciting. So I don't see the finish line.
Are you seeking relief from joint pain? Would you like to see if hormone replacement therapy would benefit you? Call Longevità Medical at 585-684-8651 to schedule an appointment, or visit longevitamedical.com. Longevità Medical, the Quatela Vitality Center.